This video is the FUE donor scar of 2000 graft and a year follow-up. We shave a client completely using the clipper without a scar. Again, no surgery without scar, but the FUE scar have tiny dots of scars scattered throughout the back like a mosaic pattern, allow you to wear your hair shorter. Unlike the strip method or the FUT leave you a linear scar running from one ear to another ear, permanent for the rest of your life. The FUE scar is tiny dots of scar scattered throughout the back like a mosaic pattern. And why FUE is popular is because it's allowing an individual to wear his hair or her hair shorter. FUE is follicular unit of extraction. It's not only less invasive, less bleeding, less chance of infection, no numbness, and no scalp tightness when you compare that to strip method. But the downside of FUE is it costs more than the strip method. The number of grafts we can do less, but again, we do 2,500 grafts on average per day. There are days I can go beyond 25, that is 3,000 or more. Where the strip method, you can do 6,000 grafts per day. The other downside of the FUE is the growth rate is pretty much comparable. I mean, if anything different, FUE is slightly less. It's 5 to 10% less. Now, you can have excellent result with my work, whether you choose the FUE or the strip method. Although my FUE is slightly less than my strip method, but if you compare my result using the FUE method compared to anybody who does a strip, my FUE still can have better density or mud. And so it's very important that it's who you choose. Again, this is the FUE donor scar on an individual who had 2,000 grafts and a year follow-up. And he shaved without a scar by the clipper. I'm going to turn his head this way. I'm going to turn his head this way. You see, the scar is there. It's hard to see. Again, it's no surgery without scar, but FUE scar is hard, very small and scattered, and allowing individual to wear his or her hair shorter. And it's a less of regret, because even you go to gym, people can't really tell you have had surgery. It's hard. But the strip method, people can see the linear scar, so it's easier to see and spot with the strip method versus the FUE. And as you know, through many years' experience, I invented the technique called the DFC technique. DFC, the Diep FUE Curve technique, is the form of FUE where I can harvest straight hair or the curly hair and predict how the precise angle, and go in a precise angle and harvest the hair graft out with great efficiency. The most important thing when you choose FUE surgeon is to ask, are you personally pulling the hair graft out? You don't ask, are you the one who doing the surgery? Because everybody, although they don't pull their hair graft out, they do, they buy a machine to pull it out, but then they make site and they say they do the surgery. So to find a surgeon to produce good result and a surgeon who specializes in FUE, those are the surgeons who tend to pull the hair graft one at a time. And then another group of doctors who cannot do the FUE, so buy the machine, the robots, and the neograft. And the neograft technicians pulling the hair graft out, so there's no comparison to the surgeon. The robots, again, it has higher transaction rate than the doctor. Thank you.